What is Pollen syndrome? Pollen syndrome is a birth defect. It affects 1 in 20,000 newborns, and it's 2 times more likely to occur in males than in females. What are the characteristics of Pollen syndrome? The main identifying factors in diagnosing someone with Pollen syndrome is visual observation. People with Pollen syndrome have underdeveloped or lack muscle in the chest area, but they can also lack muscle in the back area or in the arm of the affected side. In some cases, there's also a hand deformity as well, and this can be in the form of webbed fingers, shortened fingers, or a combo of both shortened and webbed fingers. Is it a genetic disorder? This is a big one, but for the most part, no. Researchers have not linked Pollen syndrome to a specific gene. This pretty much means that your kids will not pass it on to their kids. The most factual theory as of now is that there is a interruption to the blood flow of the fetus in the 6 to 8 weeks gestation period, and this interruption to one side of the fetus's torso is what causes the underdeveloped muscles and all of the hand anomalies that are associated with Pollen syndrome. Hello, my name is Lorena, and my son has Pollen syndrome. So as far as my pregnancy goes, it was pretty much normal. I didn't have morning sickness. My energy levels were normal. There was no indication of anything being wrong when we went to go get the ultrasounds done. So baby Charlie decided to come 2 weeks early, and as I am giving birth, you know, they hand over the baby to you, and my motherly instincts took over, and I quickly looked over the baby and I noticed something was wrong immediately. Babies tend to have their fists clenched, so you can just tell there was a difference between the left hand and the right hand. I did bring this up to the nurse that was there, and she told me everything is fine, don't worry about it. And I can understand because I had just given birth. They didn't want me freaking out. So they took the baby away from me and they went to go clean him. But I was freaking out, and I just kind of told my significant other, like, hey, you know, keep an eye on the baby. Something's wrong with his left hand. And sure enough, he confirmed my concerns by giving me a slight head nod. So I created a loose timeline from the point where he was born all the way up to now, so that you can get an idea of how everything kind of went down after I gave birth to him. So after about 1 hour of me giving birth, and after they cleaned the baby, we sat there and we observed him for a little bit. The midwife that helped me give birth was there, and she did see his hand, and she said that it looked to be syndactyly, which pretty much is webbed fingers. At 3 days old, his primary care doctor looked at him and she noted the webbed fingers. She also noted that the fingers were shorter on his left hand, and in addition, he didn't have as much muscle as he did on the right side of his body. Once that observation was made, she scheduled me to see an orthopedic doctor as well as a geneticist. So the first doctor's appointment he had was at 3 months, and that was with the orthopedic doctor. When we went there, they took an x-ray of his hand, and that x-ray was pretty much just to confirm that his bones were not fused on the hand that was webbed. And once that doctor's appointment was over, it scheduled us for a 1-year checkup of his hand. So at 6 months, we go and we see the geneticist. The purpose of us taking him to the geneticist was to just figure out what was wrong with him. And as soon as she looked him over, or she confirmed that he had Pollen syndrome. This was a visual observation only. I was a little bit in shock because I thought that there was going to be some sort of blood being drawn and that would confirm that he had Pollen syndrome, but nope. They looked the baby over visually and they make the diagnosis. So we've just recently approached baby Charlie's first birthday, and we just got through seeing the orthopedic doctor for his 1-year checkup. At this appointment, what they did was they took x-rays of his hand, and at that appointment we discussed surgery. The doctor told me that after the 1-year mark, you can pretty much schedule the actual procedure whenever you want, and he will have to be in a cast for, I believe she said 1 month. So at this point, I'm pretty much just waiting for a call from the surgery scheduling center so that I can schedule the surgery so that we can get it done and get it over over with. So throughout his 1 year of life, he's needed physical therapy to reach certain milestones that other babies would normally be able to do on their own. For example, crawling. He doesn't crawl like normal babies. He commando crawls. So if you lay him on his belly, he'll just kind of like and now he's entering the stage where he is going to start walking soon. So I don't know how he's going to do with walking or when he's going to start walking, but we're being very patient, and I'm not going to be pushing him to do anything crazy because of course he's just a baby. I do plan on documenting all of this on my channel, I don't know, in the hopes that maybe it helps somebody out. YouTube is a pretty cool place, and I think it's a good way for people that have similar situations to connect. I guess at the end of the day, that's all I'm trying to do. I hope I can connect with others who have gone through this, are currently going through this, or maybe I can help somebody out that is going to go through with this in the future. If you're interested in watching baby Charlie's progress, his Pollen syndrome journey, other aspects of my life, I invite you to subscribe to my YouTube channel. Thank you for watching this video. I really do appreciate it, and I'll see you on the next one.